Hi, folks. I'm Steve Adubato. We're going to get right into this with Dr. Maureen Coyle, psychologist and visiting professor at Seton Hall University. Doctor, great to have you with us.
Thank you for having me.
I'm sorry for interrupting you. We're going to be talking about social media and technology, and so the delay is normal. So how about this? I've been obsessed by the fact that not just our 11-year-old daughter, Olivia, but countless millions of other teens, the phone, Instagram, Twitter, and then I want to have a conversation, and it's very hard. I take the phone away for 2 minutes. She thinks it's been 20. The prefrontal cortex of children not fully developed, which impacts their impulse control. Help us understand.
Sure. So our brains develop back to front. So we first get the visual, and then we get the prefrontal cortex develops last. That's in charge of your planning, your decision making. So that doesn't fully develop until your late 20s, some estimates even early 30s. So these children and adolescents are at increased risk of not being able to manage their technology use well, because a part of the brain that tells them, hey, you've been spending too much time on Instagram, isn't developed yet. So it's harder for them to develop good habits when their brain actually isn't fully developed to help them build those good habits.
Advice for parents. By the way, our director and our audio expert just saying, hey, listen, I'm taking the phone away and I don't care if the kid's upset. Me, I actually want my daughter to like me, which makes me a weak parent, a weak father. Give us some advice.
Absolutely. So as we all know, when it comes to children and teenagers, when we tell them no, that just makes them want to do it more. And it really starts with the parents having good habits, because children pick up everything that parents do. So if the parents are on their phone a lot, not paying attention to their children, they need to break that habit in themselves, so their children are more likely to see a good model of good habits with the technology. And it's also important to help children understand the dangers of the technology, understanding that whatever they post online goes into that digital world and it's there forever. So, I've heard some people say, if you wouldn't want your grandparents to see it, then don't post it. And I think that's pretty good advice for thinking about things that we might easily be embarrassed by, that we wouldn't want family members to see. So thinking more mindfully about what we're going to be doing online. And then also trying to push children and adolescents to engage in self-reflection. After they're scrolling, how do they feel? Do they feel good? Are they happy? Are they sad? Are they lonely? If they're feeling more of those negative emotions, then for themselves, they should be thinking, well, maybe I should be spending my time on something else that isn't going to make me feel more sad or lonely or anxious, etc.
So as we do this program at the end of 2021, will be seen in 2022, there are hearings going on in Congress. They'll continue to go on. And leaders of social media platforms, yes, Facebook, their parent name is what it is right now, and they own Instagram, correct?
Correct. And WhatsApp.
And WhatsApp. My wife, by the way, I don't know if Jennifer is going to watch this, but Jen, you got to put the phone down when I'm talking to you and we're telling Olivia to put her phone down. I do the same. We're all guilty. That being said, do you find that social media CEOs, leaders are acknowledging that their algorithms, that their mechanisms to figure out what gets kids, preteens, teens into, that they are manipulating that information, that they are utilizing and hooking kids into stuff that's unhealthy for them? Are they acknowledging it, A, and B, if they're not, does Congress have a role in regulating it?
So I think that they have to reckon with it. There has been a call from psychologists like myself to get Meta and other large technology.
Meta, the parent company of Facebook. Go ahead.
To be, more explicit on what they are doing online, because they do their own independent research and it doesn't go through the same standards as the research that we do by getting ethical approval from a board. So I think that they have to, no matter what, recognize that we are seeing effects. We are seeing the mental health of our children and adolescents being hurt right now, and they're spending so much time online and they don't know exactly how to use it well. And it's hard when you have these companies, they make more money the more that their users are engaging with them. So trying to get them to work against their own financial interest is going to be challenging. So I think a push to have regulation might be inevitable for the sake of all of our well-being. Because like you said, it's hard for even adults to manage their time well online and not just be looking at their phone when they're having a conversation. So it's something that we really need to have regulation on if we're going to actually be able to push these companies into the direction to consider the ramifications on our well-being.
And by the way, I don't even want to disclose or admit how often I go down a rabbit hole on some social media platform, and an hour later I'm thinking, what did I just do? So I don't want to be holier than thou in this. Real quick, I also want to acknowledge that Seton Hall University, one of our higher ed partners, in which we identify academics and scholars to come and talk about these things. And I want to ask you this, as we have about a minute left. Disproportionate impact on teenage girls, pre-teenage young women than boys? If so, what is it?
Yes, so we are seeing, when it comes to Instagram specifically, having more of an effect on adolescent girls in terms of their self-consciousness, their self-esteem, because they are being bombarded with these images of perfectly sculpted bodies, and it really makes them internalize negative feelings about themselves. So we also are seeing more self-harm and suicide ideation in teenage girls, more so than boys. So they seem to be getting even more negative effects on how they are seeing themselves in relation to what they see on Instagram specifically.
And that being said, let's be clear. I know that for the cover of a book I wrote, they airbrushed it. They did certain things that make you not have as many lines. Okay, fine. Yeah, I did. But that we're talking about every day, all the time, with people who don't tell you that on social media. So you're looking at this woman or this young girl and saying, hey, look at me. Look, we play games with kids' minds, do we not? And their self-esteem.
Absolutely.
30 seconds or less.
There has been a push to actually have a warning or banner to say that this picture has been airbrushed. I know that it's moved forward in Europe in some countries. So I hope that we see something like that here, where people can see this is photoshopped. This isn't a realistic body.
By the way, Dr. Cole, I want to thank you so much. We appreciate you putting perspective on this. And let me disclose now, in an upcoming book in the next year, the cover will be airbrushed. I'm just telling everybody right now, get that out of the way. Thank you, Doctor. Well, all the best.
Thank you for having me.
Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by RWJ Barnabas Health, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, Summit Health, PSE&G, Wells Fargo, the New Jersey Education Association, the Russell Berrie Foundation, and by New Jersey Sharing Network. Promotional support provided by the New Jersey Business and Industry Association and by bestofnj.com.
If you need to see a doctor, RWJ Barnabas Health has 2 easy ways to do it from anywhere. You can see an urgent care provider 24/7 on any device with our Telemed app. Or use our website to book a virtual visit with an RWJ Barnabas Health Medical Group provider or specialist, even as a new patient. You've taken every precaution, and so have we, so don't delay your care any longer. RWJ Barnabas Health. Let's be healthy together.